kañ nga gëj a dem lopitaan pour nemmeeku sa wérgu yaram
ndax xam nga sa wérgu yaram fu mu tollu
est-ce que yaa ngi bàyyi xel ci li ngay lekka
wala exercise bokk na ci li ngay sóoraale ci sa dundu pour am ci lu la leer toppaleen ñu leen di bu ne ci suñ programme yi health check nga xam ne lépp lu ñuy waxtaanee dina méngoo ak sa wérgu yaram.
I am Dr. HASSAN AZADEH. I am the clinical director of MEDICARE clinic and also a university professor in obstetric and gynecology and senior lecturer teaching obstetric and gynecology. I have been asked to put some highlight to a normal pregnancy and to an abnormal pregnancy, which will end up with miscarriage. They call it sometimes abortion, but miscarriage is more medical word to describe it. Obviously, pregnancy is a very pleasant and happy occasion for the family. And every family would like to have not only one child, although at least 4 or 5 children in African cultures, which it is possible, and the pregnancy can only be normal if as soon as the female missing her period, even if it's only 3-4 weeks, and she is married, she is in the coupled relationship, that she possibly could be pregnant. What to do then? Next step is either buying the self-examination, self-test of the urine at home, shows positive or negative. If there are 2 red lines appears, it means 100% is a pregnancy. Furthermore, they can eventually come into the clinic and do the test. Because if the pregnancy is being diagnosed, it's been found out in early stage, that you can reassure it that this pregnancy, by regular attending, we call it antenatal clinic. This is, or they call it in Gambia, coming for nurse. In those time you come in the clinic, you will be checked, your blood pressure, your some test is being done, and to find out whether any kind of underlying disease which you are not even aware of it can interfere into your pregnancy, and you eventually end up losing the pregnancy. I give you an example. Some overweight patients, we call it obese patient, although they might have no obvious signs and symptoms of disease, but only if their blood sugar level is high. What do we call it? We call it diabetes. Diabetes, in a very early stage, it doesn't show really much of obvious symptoms. But diabetes, it can interfere for a woman pregnancy. A simple test, a blood sugar test, that shows whether the level of the sugar in your blood is high or is normal. If it's normal, you have a peace of mind, you will have a healthy pregnancy. If it's slightly high, there is a treatment for it. So do not get upset if you got pregnant and you come and do blood test and then it's slightly high. There is those kind of diabetes during the pregnancy, it is treatable. There are medicine for it, and we can control your blood sugar and helping you with your pregnancy, look after you so that you will not get any complication during it. But if you don't know that you should have diabetes and go ahead with the pregnancy, either in the first 3 months, you eventually end up to have abortion, miscarriage, or eventually during the second and the third time of the pregnancy, you become more and more complications. Advice, just to check your blood sugar. In 5 minutes, you will have the answer. Or you might not have a serious high blood pressure, a mild blood pressure, and then emphasizing women who are overweight is one of the reasons they can develop diabetes, one of the reasons they can develop hypertension. As soon as you get pregnant, it's proven you are pregnant, even at a very early stage, this kind of test should be done to see whether there is any underlying disease can eventually harm your pregnancy. And that we call it going to the clinic, nurse, to the midwife, to be tested like that. So, when I say overweight, that is one of the commonest problems during the pregnancy. During the pregnancy, the stomach is very, very sensitive. You have to reduce these very spicy foods. The spicy food get you in the first 3 months of the pregnancy, they give you like a nausea, vomiting, pain. Advice, reduce the spicy food and pepper actually during the entire pregnancy. To reducing the pepper is healthy for everyone. It's not only for the pregnancy, but the pregnant woman's stomach is very, very sensitive. You can avoid that. And you may remember and know from other people how often during the first 3 months of the pregnancy women become unwell, vomiting, dizziness, dehydrated. These all could be checked and could be advised. We have so many of midwives throughout the country. They are very well aware of this kind of diagnosis, and also they are very aware how you can treat them. You need to take advice from the midwife. You need to take advice from the doctor, because every single word we share with you is for you, is for your health, is that you have a healthy pregnancy. Do not ignore that. And during the entire pregnancy, the length of the pregnancy is about not 9 months, as people think it's 9 months. It's 10 months. It's 40 weeks. So it's a long way to go. And the babies grow, and they give you some more pain in the abdomen, in the stomach, and the back, and the side, and some kind of dizziness. These are the symptoms, the healthy symptoms of a pregnancy. But if anything beyond that, more than that, I think the best way is when you go to the antenatal clinic, you explain to the midwife, you explain to the doctor, and they know how to deal with it. So these are very simple advice I'm trying to share with you, and I really hope that you're taking care of that. Do not sit at home, say it will get better, it will get better. Sometimes it doesn't. Sometimes might eventually get better. But do not take a risk. You are responsible for a baby growing in your womb. You're responsible for yourself, for your health, and also very much responsible for the health of your unborn baby. You have to take it very seriously. And we always advise pregnant women, the pregnancy should be supported by your husband, by your partner. If the husband give his support to you during your pregnancy, make your life much easier, not only physically, also psychologically. That is something what we always advise. The husband should take part of some responsibilities during his pregnant woman, so that together they can handle the God given to them such a wonderful baby, to be healthy and to be delivered healthy without any complications. Obviously, the clinics, the doctors, they are always alert for any kind of emergency, day and night. Almost every government clinic, or even private clinic, they run the clinic for 24 hours. They have staff of midwife and the doctors. Make use out of it. Go and be checked. While we check, we not only give you medicine, or we not only the test, we give you a lot of advice how you can keep your health to the end of your pregnancy. Unfortunately, the rate of miscarriage, or you call it abortion, miscarriage, are very, very high in the Gambia. And those miscarriages, many of them, they could be prevented when it's been diagnosed at an earlier stage. And you know how really sad and frustrated is when a woman after sometimes got pregnant and within few weeks eventually start bleeding and she lose the pregnancy. You can avoid it. Take advice, take care, get your test all done, and take advice of midwives and doctors who they are there for you. And then you can carry on. So many of the miscarriages, I don't have a statistic in the country, but I would suggest perhaps more than 85% of miscarriages, we're talking about the first 3 months of the pregnancy, could be diagnosed, could be prevented by giving advice, medication, and care, so that after so many long time, eventually you got pregnant, you carry on, you take the advice, and you will end up to have a healthy, loving baby, which brings so much of happiness into your home, into your family. You might think this advice I'm giving to you, they are very simple. But let me emphasize it to you. These simple advice I'm giving to you, they are life-saving. This is my profession. This is my responsibility of doctors, midwives, dealing with pregnant women. Although they might sound a bit simple, but the continuation of underlying, even mild underlying disease, they can end up with losing your unborn baby earlier or later. We will have more talk about the how you can save your pregnancy in the next future with another program we will record it. But please take simply those advice I am trying to share with you to help you, for you to have a healthy, lovely baby and happiness into your family. Thank you so much.